Welcome to the first ever Active Health Clinics podcast, where we're going to talk all things health, fitness, and performance, where we believe in taking an active role in your health. I'm Dr. Josh Mason, a chiropractor here at Active Health Clinics. I'm here joined with my brother, Dr. Zach Mason. This is our first ever podcast, and we're excited to roll this out to give you guys more and more information about health, performance, fitness, anything that's related to your health. We know that you need to take that active role. But today, for our first podcast, we thought it'd be great to just start with our origin story of Active Health Clinics and even how we became chiropractors. It's kind of a weird story that we both end up being a chiropractors. A lot of times patients really like, how did you both become a chiropractor? And I oftentimes don't even know how to answer them. What made you officially decide why you want to be a chiropractor?
Well, I think, the first time I ever thought about being a chiropractor is just my first experience with one. And what it was is I had injuries through high school sports and things. And the route that I was taking just wasn't working. Medicine wasn't working. Nothing was working. My first experience with a chiropractor, I mean, it improved my function, my decreased my pain by almost instantly. And the more I went, then obviously the more I benefited. And then I was always told chiropractor are quacks and you got to go this route. And so it changed my philosophy as far as, well, this guy's helping my body. This guy's just kind of treating the symptoms. And that's where my mind shifts, switched totally. That if we can help the body function better and decrease pain, we're going to have a better outcome than just relying on outside means.
Right. It's so interesting that he had such a profound experience. Dr. Zach had a life experience that brought him to chiropractic care. And mine was much less not eventful. Oddly enough, how I decided to become a chiropractor, when the day I decided to be a chiropractor, I'd actually only been to the chiropractor 2 times in my entire life. And it was, again, for sports injuries. We come from a sports background. At the time, I was dating this girl who is now my wife of 20 plus years. And I was giving her a massage on her shoulders. At the exact same time, she'd never, ever been to a chiropractor, ever. And she said, "You should be a chiropractor." And immediately I just said, okay. So it was just like a blind faith thing. But obviously, the more I looked into what chiropractic was, the fact that you did work with the body, I really liked that. I really kind of was looking to get into maybe healthcare, but oddly enough, I was going to Iowa to major in business. But the more I looked into it, there was the business aspect, because a lot of us do have a clinic of our own. But it just matched and just continued to match and match and match. But it's always been funny to me that we didn't have that. I didn't have that direct experience with chiropractic to push me there where you clearly did, which is kind of a neat change.
And different people have that kind of experience.
Yeah.
I mean, it's weird how even in school we met people that, I mean, my experience is something different, but there's a whole profound other people that have way more profound life-changing events with chiropractic.
Right.
And I think that was kind of the awe of chiropractic was, wow, there's some pretty crazy stories out there about life-changing events, and all it is with someone's hands.
That's always and still has been the most amazing thing going through this journey. Through the history of Active Health Chiropractic and Active Health Clinics now is we've always stayed true to that chiropractic philosophy. As we've often talked, if we could just apply the chiropractic philosophy to all areas of healthcare, that all healthcare, there's a time and place for everything. And I think we'll probably eventually someday just do a whole podcast on talking about the root philosophy of chiropractic and how, again, if we could apply that across the board, it just goes so much better. I often tell the origin story of Active Health Chiropractic transitioning to clinics, and people just find it kind of intriguing and amazing. We didn't start Active Health Chiropractic for more than anything other than we were chiropractors, and it was time for us to have a business of our own. My story is after I finished chiropractic school, I returned to Fort Dodge. I was excited to join an office in town, and I was there, and I learned a lot at my first job. But it was time for a transition. Things happened at the clinic. And I had the opportunity that it was time to open our own. And it happened really quickly. In 6 weeks, we went from concept of the idea of having Active Health Chiropractic to opening the door. So in 6 weeks, we found a space. We completely built it out. And we started seeing patients. I'll never remember, I set a deadline of seeing the first patients the first day, and the ceiling, the drop ceiling wasn't quite put in yet. And so it was dusty, and we had extension cords all over the place. So we had lights in the corner, and it was looking back, it was kind of embarrassing, but the patients didn't care. The patients loved receiving the chiropractic care, and they just wanted to come in. And it was just a fun time as far as the energy goes. Now, we were blessed that the business got very busy very quickly. At that time, you were still at Palmer. And it was interesting that I had started that, and it was about October-ish. And all the way up through June, I attended your graduation in June. And I remember attending your graduation, and you weren't even sure, like, an official plan of yet.
No, we had no plan. My wife and I, we were kind of in the air where we're going to go.
Yeah. So you kind of looking at some different places in the Des Moines area. And it just kind of, again, I believe in just fate. Things happen for a reason. And we were busy enough, and I attended his graduation, and quite frankly, I needed help. We were getting too busy. And it's been so fun to just get us to come back together and be able to do this together. Looking back on those times, what do you think was like one of the most challenging things in those early years?
I mean, the most challenging thing, right coming out of school is just finding your groove. And then we come in and you're back in your hometown and things pick up. Just trying to find that groove of where you are as a doctor, just because you're always kind of questioning your abilities. And so the good thing about where we were in our hometown was that we always had someone coming in as far as patients. And so it gave you a lot of practice. And then once you find your groove, then you start creating your philosophy at the same time, because you're seeing different types of patients, different kind of modes of life. And that creates your own philosophy as yourself as well. But bringing that in from chiropractic school, you're kind of thrown out there, like, see how you do.
Yeah.
And it's great having a guide.
Right.
Because you had already been doing it for so many years. Right. That it was kind of a nice guide that I could reflect on and be like, okay, Josh is doing these things right. Like, I like that. I can change these things for my own self. And that's kind of how you adapt your own philosophy as far as treating patients and things.
That was hugely beneficial. Not only, like, I did have the previous 4 years of experience, and I was working with some docs that had been practicing for years and years and years. So again, I would not change those first 4 years of my career for nothing, because I learned so much about just how do we talk to patients, how do you educate the patients, and not only your philosophy of how you're treating, but how to talk to patients. Okay. I had the same issue. We both graduated from chiropractic school pretty young. We're 23, 24 years old, and we looked young, and patients come in, and they're your ex-teacher, your parents' friends, or aunts and uncles, and they look like you, like, you're not my doctor. What are you doing? Right. And so that was definitely a challenge initially. And obviously in those early years, we were having a challenge of just figuring out who we were as a business. Like who are we treating? What services do we want to offer? How do we treat our employees? How do we compensate our employees? So there's obviously starting off a brand new business. Like you said, in school, we're taught to be pretty damn good chiropractors, but we're not really taught the business side of it. So it's been a struggle. But what, in those early years, it was just you and I, a couple staff members, and 2,000 square feet. What were some of your, what was a fond memory that you had way back early?
I mean, I just liked when we started adding new services, being able to expand. At the time we could only, I think the next expansion was to like 4,500 square feet.
Yeah, it was, yeah.
And added like a really small rehab area.
Right.
But it worked because like all we needed was something small, because we got to start small before we go big.
Right.
And so I think being able to add those incremental services to the patients, we see in our patients go from just receiving chiropractic and some modalities to chiropractic and some traction chiropractic and some decompression therapies into rehab.
Yeah.
And so incrementally you've seen like the adversities that each patient had, and we had to find different tools to kind of treat each one of those different diversities and those problems.
Yeah, we often talk that we don't feel like our adjustments, we don't do anything special. But even when it was just you and I in our hands and the basic therapies, doing adjustments and some ART, we were getting great results. But we always did see kind of a gap of patients that we just couldn't get better. And so or you would send them and they would get care that didn't align with what we wanted. And so we just always wanted to offer more. So in the first building, to be able to just expand, get that rehab going, add those decompression tables and get that rolling. We saw, we were from, 85, 90% of people getting better to 95% getting better. We were able to help them even more. So that was super fun to be able to do. And then, through the years, so we also added an associate doctor at that time because we were continuing to get busy, continued to add more staff. And quite frankly, we just outgrew the first building. It was built for our needs at the time. The layout wasn't what we wanted. And so it was time for us to start to look for a new building. And so in like 2016, we probably started looking for a new building. So we opened in 2010. We were there about 5-6 years-ish. We found a building, but then we had to do the construction. So we found this building that used to be the Golden Corral building. So it used to be a buffet, probably actually right where we're seating may have been like a kitchen or something. So we had to rehab this building and get the layout to exactly how we wanted it. And it turned out beautifully. It was kind of a fun deal. A lot of us people don't know, but Dr. Zach's wife, who does, Emily does all the marketing. She's also a designer. She went to Iowa State University for it and she's fantastic at it. So she had the color scheme down for us. And it just looks fantastic. And we get compliments on the building all the time. But what the space also allowed us to do was continue to grow. Even though when we first moved here, we kept with our basics.
Right.
And then we continued to see that gap. I think we were continuing to do what we did and we were still getting good results, but we still had this little gap that we wanted. And so we saw some other offices starting to integrate a medical practitioner, a nurse practitioner into the care. And so it was a big debate for us to do that. Like, if you think back, what were some of your concerns about, expanding and adding those types of services into our?
Well, concern of mine is just our philosophy.
Right.
I mean, we all believe above, down, inside out. That's the way the body functions. And so we had this that's an outside in mentality of bringing something else in. And so that was just kind of a question mark for all of us. And the one thing I always look back to is I always remember one of the principles of chiropractic, and I think it might be 24, I might be stand corrected, but there's this part of that principle of chiropractic of limitations of matter.
Right.
And so that's where we ran into, is that we could do so much things for the body, but then we ran into the wall of something of, like, say, an arthritic knee.
Correct.
And it's so far gone that the things that we had available, we just couldn't help them. I mean, we could get them to a better functional state, but it just always kind of like refurbished itself.
Right.
And then again, when we refer out, it just didn't align with our philosophy. And so bringing in like more of the integrated side, it always goes back to that limitations of matter. Right. There's only so much that we can do before we start to change course and have to do something else. I literally
remember on that topic, I would literally remember showing patients x-rays and showing them the loss of joint space. And I would even use my finger just like this. And I would say, see right there, there's a loss of joint space. And I would say to them, there's nothing we can do to get this back, but we can help the function as best as we can. Literally, I would say that out loud. And then when we found the integrated model and saw the tools they were using, and literally we could reverse that talk and I could say, yes, the goal is to actually expand that.
Correct.
That was what kind of the selling feature to me to want to expand and add this service, because that is, again, the true philosophy: above, down, inside out. We want to treat the body from the inside out, above, down, through the nervous system, and then we can assist the body to heal. And so to be able to help the body actually grow and almost, there's still limitations to matter, but to almost reverse that was just, that to me, that was worth the risk.
Right.
Obviously, that risk took risk in our own philosophy, risk in we were kind of creating a new model.
Right.
And obviously, as a business side, it's a risk of a salary of additional people, and then, quite frankly, a risk of, like, what are people going to think? You know, we at the time.
Well, and honestly, in our town, that's a totally different thing that no one's ever thought of.
Right.
And so we're bringing in state of the art technology and medical that no one's seen yet.
Right.
And I think that's huge. But at the same time, we didn't really know what it's going to do at the same time either.
No, right. We were going off what other people were saying
exactly.
at the time. Yeah.
And then when the results started coming back, it's like, wow.
Yeah.
When we mix chiropractic with making the body heal from the inside out, and then basically adding some of these other modalities and things, people were just, things were changing.
Right. And so we've been integrated now for 5 years ish. And so we've been integrating medical care with some PRP and stem cell injections in with our care. And even that we've continued to add. I mean, we started with just the basic injection. People would come in and say, I have arthritis, and we would inject them with stem cells. That was actually our treatment plan when we started. And now we've been able to continue to build on that and add, pulse wave and laser. And these are all services in the future podcast we'll get into. But again, that's one thing I've really enjoyed about being a practice of our own and being two people that we always want to push the envelope. We want to push and always do what's best. And so as new technology comes out or new research or we learn something new, we're able to just implement it immediately and our patients benefit from it. Has there, since we've integrated, what have you noticed? Is there one of the tools that we use that has been your favorite to see and make a big difference with people?
I honestly think the laser.
Right.
Yeah. I mean, it's a Summous laser. I mean, honestly, it's pretty darn amazing what it does. We'll get into it in a more specific podcast later, but when we started implementing that with a lot of our care plans, I mean, my own kids have great results from the laser, mind-boggling results actually of things that happen. And I think that's huge. As soon as we implemented that, I think that was changed our whole mindset on a lot of things, because that resonates with even the chiropractic philosophy of from the inside out. Because what it's doing is basically stimulating your body to heal itself from the inside, and to use photobiomodulation. That was at the first time I heard that, I'm like, really? Yeah. And then when you see the results, it's like, wow.
Yeah, I would agree with you. We have stem cells injections. They're amazing. We have the PRP injections. But as far as like the simplicity of the laser, that might be the biggest wow for me. Because I mean, I had heard of laser therapy for 10 years before we got one. And I always thought there's no way it does as good as what people are saying. And by God, it did. So I kind of agree with you that that's probably the biggest tool that's made the biggest impact on our care. But again, what we find out is when we incorporate all of them. Yeah, every time, for sure. Every time when we compound, and I think that's what we tell people is when we compound the tools, it just makes such a big difference.
Well, and I think that's the biggest change in our practice in general. Is it's the package. It's not one thing particularly. Chiropractic is obviously awesome. That's our philosophy. That's our basic. That's our go-to. But when we combine all these other services to basically more of a rounded approach to the care plan, that's when you start seeing the great results that we've gotten.
Yeah, and I think that's, as far as I reflect on where we're going next, I think that's it. There could be a new technology, a new tool that we find, but I think what I'm really excited about is how we can actually start to treat right now we are treating mainly physical medicine. So we're treating joints and muscles and tendons. And guess what? All of those can heal better and get better results if the entire body is healthier. And so finding a way.
But we've been starting to treat the gut more.
Yeah. So
that's something we've been implementing.
We're tiptoeing our way into it. And we've started implementing into our care plans a lot more nutrition as far as just vitamins. We've been starting to implement some peptides. It's making a huge difference with the interior of the body. But if we can actually get people and do this appropriately, we'll use blood work. Blood work is studied. It gives us a good baseline. And to use
blood doesn't lie.
Work, no, it doesn't. You can't hide behind the blood work. But if we can start to get that and then get people on following lifestyle recommendations to actually improve their overall health, maybe. In addition to the peptides, lifestyle changes, and, eventually someday, maybe we are using some hormones to help people. I mean, those tail off as we age and can make a huge difference in all tissues. I think, so I think that's kind of potentially the next frontier, because anytime we can tell a difference when we're treating people, the ones that come in pretty darn healthy, their results are easier and better than that person that their health is not
chronically ill.
Right. So is there anything that you've been thinking about that you're kind of excited about that we might go to?
I mean, I'll be honest. We all know most medical treatments are 10 years behind.
Yeah.
we're adapting every 6 months.
Right.
I mean,
We are.
I mean, we're always looking for the newest best thing. We're always
Mhm.
looking at the newest research. And I just think we're always open-minded.
Mhm.
If we hear someone else getting some great results with some other procedure or some other modality or something that we think that we can implement that works in with our kind of philosophy and the way we want to treat a patient,
Yeah.
and it is cost effective for the patient, I mean, we're going to try it out. We're going to look at it.
Yep.
And I just think that's a great thing about us is that, you know, if 10 years ago, if you would have told me we're going to be using a laser, I'd have been like, why? We can use our hands.
Right.
But then when you
Mhm.
start using the laser, things miraculously happen.
Correct.
And so I just think we're open-minded enough that when something new comes out, we're going to check it out.
Right. So kind of wrapping up here, to kind of foreshadow going forward, guys, what we're going to use this platform is just to continue to educate you on kind of what we're thinking, educate you on the services that we have going on at Active Health Clinics. And then we're going to pull in, I've already got some interviews lined up. We've talked a lot about the laser. One of the first interviews we're going to have is Dr. Phil Harrington. He's going to be the medical director of the Sumas Laser, and he's committed that he actually lives in Cedar Rapids, Iowa. So he might even come over here and sit right here and do it. But we want to continue to educate you and give you the reasons why we're doing what we're doing. And I'm so excited about the current environment around healthcare. I think people are seeing the inefficiency or the lack of care they're getting in the typical medical model. And I just think that everyone's mind is starting to shift to what we consider chiropractic philosophy. So I couldn't be more excited about where healthcare is going as far as, and I think in our community, we're leading the charge. So any parting thoughts, bud?
No, I think we hit everything we need to talk about.
All right, man. Well, again, I hope you enjoyed our first ever episode of the Active Health Podcast. Give us some grace. We've never done this before. So this was fun. I hope you enjoyed it. Like, subscribe to whatever platform you're on, and there'll be more coming and probably better looking guests and more informed guests as well. So we'll talk to you later. Thanks, guys.